Today's topic is tongue ties. This is a controversial topic that has been an interest of mine for several years after my wife and I did a tongue tie release for my oldest daughter. After seeing how she changed, I ended up getting my tongue tie released as well after realizing that I had one. It was a profound experience that changed way more throughout my body than I had originally expected. And since then, I've tried to understand anatomically how a tongue tie can cause so many changes. I'm your host. My name is Dr. Daniel Lopez. I'm an osteopathic physician that practices osteopathic manipulative medicine at Osteopathic Integrative Medicine in Lakewood, Colorado. My guest today graduated with a bachelor's degree in dental hygiene from Eastern Washington University. She subsequently became interested in the tongue and how the health of the mouth directly relates to the overall health of the body. And she opened up her myofunctional therapy practice called Faceology in Seattle in 2010 and took the entire practice online in 2014, becoming the world's first fully online myofunctional therapy practice. One of her passions is to spread and create awareness about myofunctional therapy. She's appeared on the High Intensity Health podcast, Cognitive Rampage podcast, and is a regular contributor to AskTheDentist.com. She's from the Pacific Northwest and currently lives in Hawaii, where she consults with patients, doctors, and other healthcare providers from all over the world. So I want to welcome Sarah Hornsby here today on the show with me.
Hello. Thanks for such a nice introduction. That was really good.
You're welcome. So let's jump to it. So tell the audience a little bit about yourself. How did you get to doing oral myofunctional therapy?
Yeah, I guess it didn't start off as a passion for me because I didn't know about it. Like most people in the dental field, we don't really learn about tongue ties and tongue thrusts and all of these oral myofunctional issues that I work with every day now. We don't really learn that in school. Orthodontists don't, dentists don't, pediatricians don't, ear, nose, and throat doctors don't. And these are all professionals who work in this area. So I started off like any other dental hygienist, and I got my first job, and I liked it. Patients liked me. I thought it was a great job to begin with, but I started thinking, maybe there's more to some of these things. So fast forward about a year of cleaning people's teeth and, giving injections like we do in Washington State. I really found myself in a place where I just felt like I don't want to hurt people. I don't like causing people pain. And to be a good hygienist, unfortunately, sometimes you have to hurt people. So I looked for how do I transition and use my skills as a dental hygienist? How do I apply that to other areas? So I looked into a bunch of things, and almost by accident, I found out about this training course in a field called oral facial myofunctional therapy. And I was like, what the heck is that? I've never heard of it. I'm brand new out of school. I have like the latest and greatest information, so I should have heard about this stuff. So maybe it's not a real thing, but I'm going to check it out anyways. So I took this course, and while I was sitting in the course getting trained to help people with these weird myofunctional issues that I had never heard of, I was sitting there realizing I had a lot of the symptoms myself. So we could get more into what those symptoms are. But yeah, I don't think I would have actually thought the field was a real thing, except that I was dealing with this stuff myself. And that course that I was sitting in was what really pointed it out to me. So I would say, if I went back and thought about it now, I was probably in a little bit of denial. But overall, it's really what led me to keep going in this field where most people didn't know about it. And it was a struggle to get started in a field that's just not well known. And especially around that time, like the economy was crashing and there was just so much going on, in 2010. And people weren't really looking at the tongue like they are today. It's totally different.
Yeah, I think when you don't understand something, it's easy to be a little bit skeptical at first.
Yeah, I was definitely.
Yeah, so let's go over what do oral myofunctional therapists do then? Like a little more background into that, I think would be helpful.
Yeah, it's a good question because like I said, most people have never heard of this field. Most people don't know what it is, and not just regular people out there, most medical and dental people have never heard of it either. So I basically teach people exercises for their mouth. So it's a lot like physical therapy. I teach people, I say, here's 5 exercises, go do these at home. Some of it, which we'll get to more, is kind of like rehab, like the tongue tie post-surgical exercises are very much rehab oriented, like a physical therapist would. A lot of the other exercises are more preventive, and yeah, basically I teach people exercises. Those exercises are very simple. They're things that we should all do naturally. We shouldn't need a therapist for these things. I basically teach people 4 main things. Nasal breathing, something we should all do all day and all night. I teach lip seal, so how to rest with your lips together. I teach proper tongue placement, so your tongue should be resting fully in the roof of your mouth, filling up the entire oral cavity. And I teach proper swallowing patterns. So these things are things we should all do naturally the right way. And for whatever reason, which we can get into more later, some people don't, like me and like a lot of others out there. So yeah, that's basically what I teach.
Okay, great.
Mm-hmm.
All right. So then who is your ideal client? I mean, what kind of person comes to see you? I mean, is it kids? Is it adults?
Yeah.
Is it, and what kind of problems do they have?
Yeah, that's a good question too, because a lot of people like me didn't realize they had these issues. So most people who come to me and they have learned that they have myofunctional or oral myofunctional problems, usually they have pretty bigger picture issues that it's hard to really trace back down to the mouth. So a lot of the adult patients I see have sleep apnea. They have chronic TMJ pain, clenching, grinding, headaches, lots of head and neck issues. Most have allergies. Most have trouble breathing through their nose. And the thing is that I think most people don't realize it, and why it takes a while for us to figure these things out, is it starts so subtle. So I tell people every day that kids who breathe through the mouth are the adults who end up with sleep apnea. So mouth breathing and tongue position is completely interconnected, and that's where the tongue tie comes into everything. So yeah, I would say most of my patients are adults, honestly. Maybe 60%, about 40% are kids, but it's never too late to do this therapy. Anyone can benefit at any age. In an ideal world, we would all figure this stuff out when we were kids, so that way as we grow and develop into adults, our facial structures would develop and grow properly. So it's better if you can get the therapy done for a 6-year-old than it is for a 36 or 46-year-old, but it's not too late.
Well, I can tell you that I did mine in about 2 years ago, and my only regret was that I didn't do it 30 plus years ago. And I also even sent my mom to have it done. And honestly, when she was done, she was like, I feel like I can stand up straight for the first time in my life. So there was a lot of interesting changes, and I think definitely for adults, like it's not too late, and it should be something that we should be more mindful of. But unfortunately, I think there's still a lot to learn from our perspective.
Oh gosh, there's a ton of information we don't know. And I'm curious, what were your symptoms? Like, what were the first things that you noticed that made you even start looking into this stuff?
Well, my story kind of goes back to, like, we did it for my daughter, and initially my wife was like, well, she's tongue tied, and I was kind of like, well, what the heck is that? And so I started learning a little bit about it, and and I could tell that because she had an issue latching, like that seemed to be one of the hallmark symptoms for babies and things like that. And then when my wife went back to work, my mom was helping us with the baby, and she couldn't drink out of a bottle. And even though she was actually a very large baby, so we knew that the pediatrician wasn't going to recommend her having her tongue tie released. But I made an appointment with an ENT and watched her get it done. And I watched her latch immediately before. Then the doctor came in, did the procedure. I mean, it took probably 5 seconds, honestly. And then
it's easy in babies. Oh, I should say easy. It's pretty quick.
Yeah, and then watched her latch right afterwards, and I was amazed because her whole face changed. It was like her face expanded, her upper lip turned pink, and then she could also open her jaw wider. And so that really just drew my attention because of the work that I do, working on people's heads and cranial bones. Often it just, to me, it was like, okay, is this something I need to be paying attention to for adults? But I couldn't find any information. And I was like, well, I need to find somebody maybe who would be a willing guinea pig. And then later realized that I was tongue-tied, and that I was like, well, I want to try it to see if it's going to help me. And honestly, like as soon as it was done, even when my mouth was numb, I could tell that my windpipe was more open. It was easier to breathe. My whole face had relaxed. My neck had changed. It was more mobile, even though I didn't necessarily feel like I had neck issues before that. And then later also noticed, my chest relaxed, my low back. Less, a lot of symptoms that I would have never expected. And so it really was a profound experience. And I think in the right cases, it makes a huge difference.
Yeah, I agree. And I've heard, I don't want to say there's, what's that called? A backlash. But I've been hearing lately, because tongue ties, I would say in the past, I've noticed a huge paradigm shift in the past 18 months, probably, where a lot of people are looking at this. But before then, there wasn't. I mean, I was like crazy for telling people they needed their tongue tie release. People thought, I don't know what's going on with that idea, but it sounds really scary to a lot of parents when you recommend that you need to cut underneath your child's tongue. So.
Right.
As it's becoming more of this mainstream idea, I've been hearing, oh, that's just the flavor of the week, everybody's jumping on that bandwagon. And I don't think that's true. I think we finally have the awareness about the tongue that it's deserving. So just because we didn't look at it before didn't mean it didn't exist, right? So.
Right. Well, I think, one way that I approach it, that I mean, at least it works for adults when I treat them, is I actually manually treat their tongue when they are tongue-tied and show them, even just getting a small release, often they start to feel a big change in their neck, head, things like that, and they feel these body changes, and so they're often a lot more I think it's easier for them to realize at that point that the tongue is having a big effect on them. But let's go into
definitely.
What exactly is a tongue tie? Because
that's a good question. So we all have a frenum or a frenulum underneath our tongue. It's that band of, looks like a line. I'm sure you've seen it. If you looked in your mouth, for anyone who's listening, and you looked under your tongue, you're going to see the frenum. And for some people, this is too short or too tight, and it limits their mobility. So they're not actually able to get their tongue to rest properly inside their mouth. So from my perspective as a myofunctional therapist, that tongue posture is critical. And there's, the reason we got in touch was because the role of the tongue was swallowing, and I saw your article on the orbits of the eye and vision. So it goes a long way, this whole tongue thing. But basically, if you're tongue-tied, you've got a bound down tight tongue, and whether it affects just the posture or the movement of the tongue, it's causing problems for jaw growth and development in kids. I hear from a lot of parents who say, well, my kids don't have speech issues, so the tongue tie shouldn't matter, right? And I say, well, not really, because it's good if they don't have speech issues, but having that tongue tie, that restriction underneath their tongue, it's basically you can think of it as like a really bad knot in your shoulder. Like if you're getting a massage and you have just this bad knot that needs to be worked out, it's like that, but way worse. It's an anatomical midline defect that's connected. I mean, I'm sure you know this, but I'll just share it. It's connected to a very specific gene mutation, that MTHFR gene. So I do not pretend to be an expert about that, but I know that it is hereditary. It's passed down. So oftentimes, like you experienced with your daughter, parents discover they're tongue-tied because their babies have trouble feeding or speaking or things like that. So that's, I guess, a long version of what it is.
Yeah, I think the way I end up describing it to people too is I tell them, when we develop embryologically, your hands start out webbed, and then that webbing, those cells die out until they reach down to this point. And when you have a defect, like a tongue tie is like having the webbing there, and then rather than it receding all the way, it ends up receding partially. And what that, imagine if your fingers were then webbed and stuck, you wouldn't be able to move them so well. And the more you use your hand, the more fatigued it would get. And it might cause you some forearm pain and shoulder pain and things like that. And the tongue is, in a sense, the same, except that the tongue is connected to a lot more things. And ultimately you use it a lot more when you're speaking, you're swallowing, you're breathing. We're all doing that all the time. And the more you use it and the more it's bound down, the harder and more fatigued it gets. And that causes a lot of problems.
For sure. Yeah. Tons of problems. And I think, I see that question popped up there. I missed what it said. You can read it though. I can try to answer it if you want, but yeah, I think when people see it as a birth defect, even if it's a minor one, it's not, I guess I've had some people question me and say, well, I thought you weren't really into doing surgeries, because typically I'm not. So why would you recommend a tongue tie surgery? And, to me, it is. It's like, well, if your child had webbing between their fingers, you would see the need to have that webbing released, right? I mean, I think I would.
Right.
So I think it's a good way to think about it like that. But yeah, you can go on with the question. Or
yeah, well, let's talk about, are there different classifications for tongue ties? I've heard of anterior, posterior, and all that. And how do you know or tell the difference?
Yes, this is kind of a big mess. So there's not one like standardized exam for doing tongue tie measuring. And this is, I think, one of the reasons why the field is a bit controversial, is because everyone has their own version of what they think a tongue tie is. And that can vary significantly. It doesn't mean that the tip of your tongue is like fully connected to the floor of your mouth. There's a spectrum of tongue ties. So some people are going to be more severe. Some people, I honestly look at their tongue and I think, gosh, it doesn't look like they're tongue-tied, but they've got all of these symptoms and they fit into maybe not the visual version of a tongue-tie that we can all look at and say, oh yeah, that's a problem. But
Right.
they've got these symptoms that tell me there's restriction. And that's where the word posterior comes in. So if you think of the tongue like a three-dimensional, I don't know, like a tube or something, that frenum runs like a partition down the length of the tongue, like down, like in deep internally. So if in the anterior portion it looks fine, it doesn't mean there's nothing restricting the back portion of the tongue. So those are hard to identify. And a lot of times if I see somebody that have those symptoms and their tongue looks okay, I'll often say, let's do a few therapy sessions before we make the call on whether or not you need surgery. There is a lot you can do, probably what you're doing with your patients. There's a lot you can do with just muscle exercises and movements and even releasing underneath the tongue to help it get more mobility. So.
Yeah, I know from my perspective, one of the things that I've been looking at recently, I kind of came across this, and I just wrote an article about it, but and I don't know how accurate it is at this point, but it made sense to me in terms of anatomically and all that. But a way for people to tell that potentially if they do have a tongue tie is to actually arch their back and look up, and then with their mouth closed, try to swallow. And if they're tongue tied, their hyoid bone is actually going to get pulled down. And so when they're looking up, it's not going to be able to come up and rise when they try to swallow, so they won't be able to do it. And I think that is a way to look at it.
Oh, I like that. I've never heard of that. So you'll have to send me that link, or we can talk about it later. But that's a cool test.
Yeah, we can talk a little bit more about that. The other thing that I realized was, it's part of it is how people are looking at tongue ties. So often when people, I know when I had my frenectomy, what they were doing was, pulling it out, looking how far you could stick out your tongue, or pulling it straight up. And what I realized was, if you pull the tip and open your mouth straight up, like it only shows a certain portion of it. And I think what matters to me is the back of the tongue. And in order to expose that, you actually have to get your fingers in there, or like some kind of forked device, and lift the whole tongue blade up. And then you can see like what, in a sense, like you would see like that whole portion that is still lingering in the back there. And I feel like that's not necessarily the way it's generally being looked at. And that's why it's hard to see, because I noticed that with mine. And it took me a while to realize that, oh, I'm still tongue tied. And it was because I couldn't swallow it. And I was excited because I was like, okay, I'm going to show my wife, what it's like to be, for people who aren't tongue tied, what it's like to be tongue-tied. And so I told her, I was like, hey, try this, and you'll see what it's like to be tongue-tied. And so she arched her back and looked up, and she swallowed, and she looked at me and was like, what's the big deal? And I was like, oh, okay, maybe that's not showing you what it's like to be tongue-tied, it's showing me that I'm still tongue-tied. So
yeah, and if you think about what's happening to those muscles when they're being bound down by that restriction, a lot of the muscles in our throat and all underneath the jaw, all around the TMJ complex, the back of the tongue, a lot of those muscles are just completely offline. So that's where myofunctional therapy really comes in. A lot of people, now that they're learning about tongue ties, they're thinking, oh, I need to go get this released. But what they don't realize is just having it released, that's like the very tip of the iceberg. You really got to work on either working with someone like me, a myofunctional therapist or oral myofunctional therapist. Cranial sacral therapists can do releases. Cranial osteopaths like you can do a lot of releases that go along to help get those muscles to actually go where they need to go, because you can release it like the physical surgery, but it's got to maintain, or you have to learn how to use and rest your tongue differently. So that's where a lot of the stuff that I teach comes in, because those muscles they're like dormant or atrophied or offline, whatever the correct terminology is, they're not working, and people need to get those muscles working.
Yeah, absolutely. So let me think. I've heard, I know people have been critical. I've heard criticisms about tongue ties, because people are getting in certain places. I feel like, certain people are saying, well, everybody's getting it. And again, like you were saying, kind of a flavor of the month thing.
Yeah.
But then their argument is, I thought only 5% of the population had tongue ties. So, from my perspective, I've always wondered, like, well, if we're still having such a hard time diagnosing it, how are you certain that 5% number is correct? But anyway,
that's a good point. Yeah. I've heard the same statistics, 5%, which is, that is kind of high if you think about it. 1 in 20 people. Right. That makes sense. That seems like a reasonable number, but, there are dentists who've told me, oh, these myofunctional therapists, they're just saying that everyone's tongue-tied. So I don't know if that's true or not, but as far as like the prevalence, I think it's more that we're seeing it now versus before we weren't seeing it. So maybe that's it. I'm not sure. Do you have any theories on that?
Well, I just feel like we're understanding it more, like in terms of how to diagnose it and everything like that. My suspicion is the 5%, and I don't know where that number again came from either. Could have been, for example, kids that had speech issues or things like that, but you're not really looking at the subclinical tongue ties, or maybe, I don't know if they were looking at babies that had latching issues or things like that. But, but I feel like I see that a lot more regularly, like at least a lot of the people that I see are tongue tied, but I also don't know if that's because the population that I get are, people who have a lot of issues related to that, and those are the people coming to me. And
that's the same flaw that I have. It does seem like, wow, all these people are tongue-tied, but that's why they're looking for someone like me or like you, because they're having these head and neck issues and they can't figure it out, and then they start questioning a lot of these things, like, is it my breathing, is it my tongue, is it my whatever, what's happening with my TMJ. So yeah, we see out of the general population, we're seeing people much more likely to have these issues too. So that plays a role too. Yeah.
And then I think, in terms of the prevalence, and I think you talked about it earlier, was the MTHFR gene defect, which, I'm also not an expert on that, but I know it does lead to a lot of midline defects, and that would make sense to me, that the frenulum is not then able to recede completely as a midline defect, and that's how I see it. And the MTHFR defect, according to the statistics that I've seen, is a lot more prevalent than 5%. So there's also potentially that issue, and that again, we could be having some subclinical tongue ties that are a lot more prominent than that 5% number we've initially seen. So
yeah. And we're both seeing people with symptoms. I do meet, usually it's like this is kind of like stereotyping people, but usually it's the wife who reaches out to me and
Right.
says, "Hey, I think my husband is tongue-tied," and the husband is like, "Well, I don't have any problems. I don't have sleep apnea. I don't have jaw pain. I don't have headaches." And so, at that point, I do say to people, if you don't have any symptoms, I mean, technically, I would just say you're okay, but we don't know if you don't correct that tongue tie today. We don't know what's going to happen a year or 5 years or 10 years down the line. So, it's not everybody has the symptoms that would make them even seek out
Right.
someone like you or me. So,
Yeah. And when I say subclinical, I mean, I don't know that that's the correct term. I mean, it's more like being able to link maybe a person's symptoms, because they could be having neck pain and back pain and things like that. And
you're right. And they're like, oh,
but you would, most people aren't going to be like, well, I have headaches and I have neck pain because my tongue is tied, that kind of thing. So
most people will not think that. It takes, I find that the people who actually reach out to me, they've spent a ton of time researching and trying things, and tons of trial and error, meeting with tons of dentists and doctors who, didn't notice it. And that's not saying that they're like bad doctors and dentists.
right.
Like I said in the very beginning, most of us aren't trained on this stuff. I mean, it's very rare that you actually have a dentist who right out of dental school is screening for tongue ties. I don't think that's happening. I mean, I hope that starts happening in the future, but yeah, it's not the mainstream way of looking at the mouth. So
Right. Well, I guess that's a good way to kind of segue into the next question, which I guess is, what kinds of effects do you see from adults who are tongue-tied? Because I know we've talked a good amount about that, but
yeah, the effects, I mean, dentally, it does have an effect. People tend to have smaller mandibles. They tend to have narrower palates or small, shallower palates, smaller mouths, more crowding to their teeth. Looking at the head and neck, tongue-tied people tend to have a much worse, risk of having that forward head posture, which of course then makes your shoulders rolled. So it's this ripple effect of the tongue. I think there's many layers here happening with tongue ties, but basically there's the tension factor, there's the compensation factor, different muscle groups having to compensate, and then there's the growth and development factor. So as kids who are tongue tied grow into adults, they're actually developing compromised like bone structures. And
right.
that sounds dramatic, but it's really not. If your tongue is not able to maintain the space of the oral cavity, you're going to end up with narrow palate, smaller jaws, and crowded teeth. And that's because the tongue is supposed to be there to guide the growth of the face in kids as they age. So it's a big deal. So I see a lot of adults with dental issues, and then all those other things that we mentioned, which leads to sleep apnea. It's really like that's the next progression. If you've got these small compromised structures, the muscular issues and the habits that go along with that, like mouth breathing, it's a recipe to give you sleep apnea at some point in your life. So
Sure.
that's those are all the things that people that I see have or have experienced. So yeah, those are the effects, I guess.
Right. I mean, I tend to completely agree. I mean, I think a lot of people notice their face relaxing and things like that. The other places that I've seen changes are in the arms, extremities, and I think that has to do with the tongue being attached to a small horseshoe-shaped bone here called the hyoid bone, and the hyoid bone has the two fascial layers. Fascia is a connective tissue throughout the body, and two fascial layers. It's the superficial and middle cervical fascia attach onto the hyoid bone. So if the tongue is tied, it tends to pull up on that hyoid bone, which pulls up essentially your trachea and I think your esophagus as well, but also pulls on that fascia, and so that fascia continues on to the fingertips and there. So I've noticed people's arms relax, and things like that. But then
that's interesting.
They get that forward posture is because as their trachea gets pulled up, it's all actually anchored down lower. Like if you think about their lungs are anchored down to their diaphragm.
Yes.
Through a ligament. And so that's much stronger than up here. So if all this tenses up and contracts, you're going to get pulled down like that, that this is weaker up here. That
makes perfect sense to me. And that is a realm I don't know about, the rest of the body. I'm so fascinated by the effects that the tongue and all of this fascia that it does connect the whole deep front line, right? So
Yeah.
I've been lucky to kind of have the chance to discuss the effects of the tongue and all of these things with someone. I don't know if you ever heard of him. His name is Naudi Aguilar. He does something called functional patterns. It's really interesting, and I'm just like, I'm a noob. I don't know anything about it really, but it's really interesting. I've been having conversations with him about all of these things, and I wouldn't be surprised if somebody who knows this functional pattern stuff, I wouldn't be surprised if eventually they find a way to release the tongue through fascia and all of these exercises and maybe some of the things you do without having the actual surgery. So I don't think that exists yet, and I don't honestly know if it's possible, but if anyone can figure it out, it's probably one of these functional patterns people. So
Sure.
hopefully they do. I'd like to know if you can do it non-surgically. That'd be kind of cool.
Yeah, I mean, I'd certainly would prefer to do it that way, but I haven't myself figured that out.
I know. I don't know either. I wish I had the answers to that, you know?
Yeah, I mean, I can tell you from my perspective, at least, I can release it or release the people's tongue and it can feel better. But when they have that tongue tie, the more they use it, eventually, which again, people talk all the time, they swallow all the time, and they're always breathing. So the tongue the more they use it, the more fatigued they get. And so it can lead back to reverting back to that pattern for that reason. And so I haven't quite figured it out. If I ever do, I'll certainly.
Please let me know. Yeah, I would love to know if there is a way that either through myofacial release or exercises or some of these full body exercise. You know, I focus on such a small portion of the mouth and face and head and neck that I know there's a lot more out there. So I often will tell people, you know, these things, our whole body's connected. You know, you can't just say, oh, I'm going to do these exercises right here and everything's going to be solved. There's a big picture to it, but you know, it's connecting all the dots, and I at least have one of the puzzle pieces, but there's a lot more to it.
Yeah, definitely. So from your perspective, like, how does someone know if they have a tongue tie, and then where would they go, or how can they know if go to get diagnosed, or where can they go to get diagnosed?
Yeah, and this I think is hard for people. If you suspect you have a tongue tie because you have some of the symptoms like headaches, clenching and grinding, TMJ problems, chronic head, neck, shoulder fatigue, pain, that forward head posture, or sleep apnea, any of these things that we've both been talking about, those could be signs that you do have an undiagnosed tongue tie. Now, getting somebody to actually recognize that and help you with it can be more challenging. Like I said, the field is growing and the paradigm around this stuff is changing, but you can still go to, like, I would say 100 dentists out there and ask about a tongue tie or myofunctional therapy, what I do. And maybe one or two will say, oh yeah, we can take care of that. Here's exactly how it works. Here's why it matters. It's still hard. So I would say do your research. I mean, that's why I offer free assessments when I work with people. Sometimes people just have questions. They just want to know, do I have a tongue tie? So, you know, find a myofunctional therapist, oral myofunctional therapist out there, someone like me or someone like you who I would say who's got lots of information. You know, check out websites. Most dentists don't know. Most pediatricians don't know about this stuff. So it takes a little digging, but if you know what to Google, and eventually, you know, you'll figure it out.
Yeah, definitely.
I wish it was easier, honestly.
Yeah, no, I agree. I mean, I feel like even after having my frenectomy, I mean, later I realized I was still tongue-tied. I was like, okay, how can I diagnose this more clearly or figure it out? And so that's kind of been my journey.
Yeah, it's tricky.
It's been trying to realize, okay, I have a whole bunch of frenulum still stuck back there that is affecting my tongue still. And
the tongue tie is just one of many ties, I guess. This group, you'll hear a term out there, tethered oral tissues, TOTS. There's lip ties, and there's even buccal ties. So some people are really into releasing all of those. The lip ties are I would say number 2 priority for me. I rarely talk about the buccal ties, but the lip ties can, I think, definitely affect breastfeeding in babies for sure. So getting those lips to flange out, you know, like open more, if they're restricted down, babies are going to struggle with feeding. So of course that has carryover effects into, you know, children and adults, but I think that's the biggest thing for breastfeeding especially.
Okay. Well, and then let's say someone is tongue-tied, whether it's a baby or an adult, what should they do about it? Like, what are the options?
The go-to thing is that, surgery I've been referring to. So it's usually called a frenectomy, a frenotomy, frenulectomy. The terminology varies, but typically it's a very easy, very quick procedure, even for adults. Most of the time, I would say it takes 5 to 15 minutes. And what they do is they either use a laser or scissors or a scalpel and sutures, and they release or surgically take care of, for lack of a better word, that frenum. So depending on the technique, whether it's a laser or scalpel and sutures, they're letting that tight band of tissue go. So they call it a tongue tie release.
Right.
Like I said before, I hope at some point we have a way of manually doing it, but I don't honestly know if that's possible. But you never know. That procedure, for me, when I work with people, I want people to do exercises before they have the procedure done. And I usually recommend 3 or 4 weeks of exercises prior to actually having that tongue tie release. Then there's post exercises that help with the healing and the new, those dormant muscles I was telling you about, how to activate those and
Right.
to, swallow, eat, speak, all of these things, rest your tongue properly. So the before and after, I think, is a piece that it's just now getting looked at. I'm hearing more and more of the dentists and ENTs who do the releases. More and more, they're starting to say you have to work with a myofunctional therapist. That used to never happen, and now I hear it quite a bit, and I think, oh, that's pretty cool. At least that tells me that there's changes happening and the awareness is growing a ton. So,
Right. Well, I know
yeah.
I've had a frenectomy twice, and I can definitely say that, it was a very, I don't want to say it was completely painless, but at the same time, after I had it, I never ended up taking any pain medications like ibuprofen even, or anything like that. And it never changed what I ate. It never changed my ability to speak. I mean, I felt like it was pretty sore for about a week or so. And then after that, it really was never that bad. Recently, I interviewed somebody else out in Singapore, a patient who just had it done, and I'd never met her previously, but I just wanted her to talk about her experiences, and I put that on my Facebook page. So if you want to look for it,
I'll look at it. Yeah. When you had yours done, was it a laser or what was what technique
laser?
was it?
So with the laser, it didn't require any stitches or anything like that. I have heard that there are some ways to do it that, like, when they don't do it with the laser, sometimes they do need stitches and things like that. But I like the laser because, without the stitches, there really wasn't any need for any follow-up with the dentist or anything after that to have them removed or anything like that. So I felt like it was just a simpler process. But
it is simple, and I find that even this is like a divided camp between people. Laser or no laser, laser or sutures and scalpel. So I tell people, just go with the experience of the doctor. Find someone who does this a lot and who's good at it, and who doesn't do 1 or 2 a month or a year. You want somebody who does these releases regularly, like daily. So to me, the technique doesn't matter as much, but there's a new technique that's kind of been started if you're interested in looking up someone else. Dr. Sarush Zaghi, have you heard of him? He's out of Los Angeles. He's got videos of all of these things on his YouTube channel, and he's doing this new technique where I've had patients who've done it and who've done the laser, and I do think it's a little bit more painful, but the success and the reattachment rates are much lower, and he's getting amazing results. And he's kind of, I would say, on the forefront of the people that are actually doing these surgeries, because obviously me and you, we're not doing that. I don't want to cut anyone's tongue open. But yeah,
I have heard about that, because I have heard about somebody out in Los Angeles doing it, a little bit differently, but
yeah, he's definitely interesting. I mean, he's a leader in the field for sure at this point, and he's got lots of good information. I'd love to hear him lecture. But yeah, so you can check him out.
All right. Well, okay. So let's say somebody is going to work with you either before or after. What's the process like? I mean, you talked a little bit about it, like that you have exercises before and after, and then what else is there if there's any.
Yeah, so the interesting thing about me is I don't just work with people who are tongue-tied. Tongue-tie is a part of what I do, but I'm also working with people who have other symptoms that affect their tongue. So a tongue tie is a physical restriction, like we said, a midline defect causing the tongue to be in the wrong place. A
Sure.
lot of people I work with have something called a tongue thrust swallowing pattern.
Right.
And that's developed from usually a breathing problem when you're a kid. You learn to breathe through your mouth, so your tongue drops down and sits in the bottom of your mouth, and it just hangs out there because of a learned habit versus a physical problem. So
Right.
first of all, I've got to diagnose, what's going on? Why are they having these problems? The symptoms overlap, whether someone's tongue-tied or they have a tongue thrust. Those things cross paths quite a bit. So the first step I mentioned, I do a free evaluation or free assessment. Since I work with people online, it's kind of, I want to do a meet and greet and just let them see who I am and see what it's like to work with someone online. The next step from there, I tell people that in order to do like a thorough evaluation, we've got to do a 90-minute appointment where basically I go through, top to bottom, what's happening, what are your symptoms, what's your health history, and how can I help? I'm learning about the patient, but I'm also thinking in my head, what am I going to need to do to help them with these things? So then from there, I typically see people for a 12-session program. For most people, that's what they need, and those 12 sessions can be completed usually between, I would say it's a 6 to 8 month period of time. So I meet with people usually every 7 to 14 days in the beginning, and then the meetings taper off towards the end. More to just make sure that the habits are sticking and they've got what they need. Their habits have changed and that we're both happy with the results and where they are. So that's how my specific therapy works. There's other myofunctional therapists out there, I'm sure, who've got their own ways of doing things, but yeah, that's what I do. Awesome.
Well, can you then share some examples of what you teach your clients?
Sure. Yeah, we can try. So I always tell people the very most basic exercise is being able to create a suction. That means sticking your tongue up to the top of your mouth. So actually forming that internal suction with your tongue sticking. You can get there by making a clicking sound like. Yep. So yeah, you just did it. So sticking that tongue up, if you're tongue-tied, it's going to be hard. If you've got a tongue thrust or you're used to breathing through your mouth, it's going to be difficult. But eventually that skill will become easier. So I would say that's a basic thing. Of course, all the exercises kind of build on each other. So by the end, we're working on things like eating and drinking and head, neck, posture, breathing issues. I try to incorporate a lot of different things. I go over a few Buteyko breathing techniques. I don't know if you've ever heard of that, but another thing that people can look into is Buteyko breathing. I think the best guy out there is Patrick McEwen. He has lots of books on, basically it talks about why it matters that we're breathing through our nose and not our mouth. So okay. I'm giving you all these other people to look into.
Yeah, no worries. That's great. I love it.
Yeah. But yeah, I hope I answered that question. I think I got on a tangent, but
yeah, no, I think that's good. I mean, that ultimately is how I show people the tongue.
Yeah, creating the suction.
Sometimes they just stick their tongue straight up. You don't see it really, and then when you do that.
Yeah, it's similar to what you're saying, like taking the finger like a prong around right. and lifting it up.
Yeah, so that's kind of the way that I can show people, and if they can open wider with that, then that's generally a better sign. But if they can't,
definitely,
they can keep it suctioned up, but they can't really open very wide, then that generally tells me they're fairly tethered. And I mean,
yeah, and it's, to me, looking at these things from, what does the suction matter? Being able to create that internal suction inside your mouth, that's the beginning of a swallow. So especially a lot of kids who have very poor muscle control, they actually can't, I mean, that's a hard skill, creating that internal suction that leads to a proper swallowing pattern with food and saliva and anything that we drink or eat. That to me, it's like a building block skill. So you've got to be able to create that suction. And for some people, that's like the first step on how they learn to get their tongue in the roof of their mouth is they create that suction while their mouth is closed.
Right.
My goal is eventually the tongue is strong enough that it doesn't need to be suctioned up in the top of the mouth. But that's where most people start. So it's a good skill to have. It sounds kind of funny,
Yeah.
but it's actually really, really important.
Right. All right. Well, so that's kind of what people are, I guess an example of people working with you, but what other issues do people work with you for?
I would say dentally. Yeah, dentally people will often, usually adults, they'll go to an orthodontist because their teeth have gotten crooked and they think, gosh, I had braces, why have my teeth moved? And so we call this, the fancy name for your teeth have moved after you had braces, is orthodontic relapse. So a lot of people come to me because their teeth have shifted, and the dentist, this is when they'll usually say to them, oh, well, that's because you have a tongue thrust. And the patient is like, well, why did no one ever tell me that? If I have this tongue thrust thing and it's moving my teeth, why didn't I know about it? So that's a reason. I see orthodontic relapse and actually jaw surgery relapse quite a bit. So the tongue, if it's pushing forward and resting in the wrong place, whether that's because of a tongue thrust or a tongue tie, it's going to cause dental issues. So I would say that's a big thing. We already kind of said the sleep apnea, TMJ stuff. But yeah, I would say that's another big thing. Or a kid is going through orthodontic treatment and they are working with an orthodontist who's been able to say, oh, you have a tongue thrust. I can see it based on the way your occlusion is. So the way your teeth meet together. Often people who have a tongue thrust will have something called an open bite or an overbite or overjet. You've probably heard of these things. So that tells me your teeth aren't aligning properly to begin with. So if we put braces on top of that, it's a very unstable situation. It's like building a house on no foundation. If the tongue is down and the mouth is open in a kid that we're trying to move their teeth, it's a flawed, it's just a flawed system. So
Right.
I don't know why we don't talk about this or look at it more, but that's a big reason orthodontists work with me. And honestly, there should be someone like me in every orthodontic office out there. So I'm hoping to see my field grow so it gets to that point, but I think we have a ways to go on that.
Yeah, definitely.
Mm-hmm.
Well, that's great. Let me see. I don't know if we have any more questions. Otherwise,
we covered a lot of stuff. That's pretty good.
I feel like we were pretty thorough, so that's great.
Yeah.
Okay, so if people want to learn more about this, I know you have a lot of information on your website. So where do people go to find out to learn more?
You can look up my website. It's myfaceology.com. My practice is called Faceology. I've got a pretty interesting YouTube channel. I try to put videos and content out there. I like to get the information out. Lots of people are looking at this stuff, but it's hard to find information. So I've got some videos you can watch. I have on Facebook, it's a myofunctional therapy support group. You can join that. I'm posting stuff in there. It's a private group, but you can join it, and I'm posting things in there all the time. But yeah, between my website, Facebook page, and YouTube channel, you'll find a lot of information about tongues.
Probably more than you'll ever
more than you'd ever imagine. Yeah. So but yeah, I mean, gosh, what else can we cover? Is that pretty good?
I think that's pretty good. I don't have any questions on the comments where specific to tongue ties or anything we didn't cover. So I mean, if anybody has any other questions like that come up later, you can always post them under the comments, and we'll try to answer them as we go along. But otherwise, thank you for having or coming on and doing this interview with me. I think it's great.
Yeah, it was really good.
Felt like it helped a lot, and hopefully it brings a lot of clarity to a lot of potential patients and parents and people who may be looking into this issue and maybe on the fence or just wanting to learn more.
Yeah, I think getting this information out there is so important. So I'm happy that you're doing this with me, and hopefully it can reach people. The way the internet works, there's information out there, so hopefully it'll reach the people who need it.
Yeah, definitely. All right, and then just lastly, for me, if anybody wants to find out more about me, my website is daniellopezdo.com, and otherwise, this has been a great interview. Thank you.
Thanks a lot.